So Madeline Lee is an associate professor of psychiatry at the University of Toronto, and she's a cancer psychiatrist and lead of psychosocial oncology at the Princess Margaret Cancer Centre in Toronto, Canada. In addition to clinical practice in cancer psychiatry, she conducts collaborative research in the areas of psychoneuroimmunology and psychosocial oncology. She has expertise in end-of-life care, emotional distress screening, and management of mood disorders and cancer. She led the development of the Distress Assessment and Response Tool, DART, program at Princess Margaret and the Medical Assistance in Dying Service at the University Health Network in Toronto, and is the scientific lead for the Canadian MAiD Curriculum Development Project, whose mandate is to train healthcare professionals across Canada in the standardized and safe practice of MAiD. So thank you for being here today. And Stefanie Green, Dr. Green spent 10 years in general practice and another 12 years working exclusively in maternity and newborn care before changing her focus in 2016 to medical assistance in dying. Interesting trajectory. Dr. Green is the co-founder and current president of the Canadian Association of MAiD Assessors and Providers. She is medical advisor to the BC Ministry of Health MAiD Oversight Committee, moderator of CAMAP National Online Forum, and has hosted several national conferences on the topic. Beyond her clinical practice, she frequently speaks about MAiD to a wide range of audiences locally, nationally, and internationally. She is clinical faculty at the University of British Columbia and the University of Victoria, and most recently is the author of the best-selling book, This is Assisted Dying, a memoir about her first year providing assisted dying in Canada. So welcome to both of you, and we'll be looking forward to your talk.
Thank you, Melissa. I'm going to kick us off. Good morning, everybody. It is still early out here, so good afternoon if you're further east. Thanks for the introduction, and thanks very much, Melissa, for inviting CAMAP to be here to present on the topic of MAiD education. I'm sorry I wasn't able to stay until the very end yesterday, but I was present for most of the day, and I know the conversations that we've been having have been rich and have been enriched by the diversity of voices at this event. So after a day of raising questions and looking for research projects and noting plenty of deficiencies, it's a real pleasure to be able to talk to you this morning about something that I believe might be one small part of one solution. So in a more positive vein, I hope. Together with Madeline Lee, I'm going to be talking to you today about the Canadian MAiD Curriculum Project. So in the next 20 to 30 minutes or so, I'm going to try to just contextualize very briefly the issue, kind of what was the situation, and in fact, what is the situation today. And then we'll focus in quite quickly on the curriculum project itself and describe its visions and objectives, its structure, and provide a sort of status update before we take questions and have some time for discussion, if that's what people want. For many Canadians, in fact, for many clinicians, MAiD still seems very much like a new concept. But in fact, it's not brand new at this point, as we all know. I'm going to ask you to play a little game with yourself and think back 6 years to the very earliest days of MAiD in a world well before the word COVID was in our lexicon, when we were shocked that the average price of a home in the GTA was as high as $750,000. And the average price of a liter of gasoline in Canada in 2016 was $1.11. And I will ask you to put yourself in the shoes of a practicing clinician, a person like myself who'd been practicing medicine for 20 years already, no longer terrified of the idea that people trusted me to do so, and wise enough to know that there was still plenty I didn't know. A doctor who had never been once, at least officially, been asked by a patient to administer medications to purposely cause their death, who is now legally able to do so under new and strict conditions, and willing to accept the responsibility to do so if asked by a capable patient who met all of the rigorous criteria. So it was, in fact, a daunting position to be in at that time, as you can well imagine. And the expression, of course, in medicine, as most of us know, when learning something new, almost any new skill in medicine that you need to learn at any stage that you're learning it, the motto is see one, do one, teach one. And I remember many examples of that. But for MAiD, of course, that wasn't really going to be possible. There was no real way to see one before we did one, or before we did our very first provisions in those first few weeks. There was no established local teachers. There was no experts we could turn to in Canada. It was really a brand new field of care. So there were, of course, some professional standards that were issued by some of the regulating bodies across the country. Not many, mind you. Quebec certainly had their own law and their own protocols, which was different. So not entirely relevant where the rest of us were beginning. But in British Columbia, for example, where I'm based, there was a professional standard issued by the BC College of Physicians and Surgeons. So we had that to consider. But of course, a professional standard is not the how-to do the work. It doesn't equal training. It was and is not MAiD education. It is a professional standard we need to abide by and be aware of, but it's not MAiD education. The Canadian Medical Association, on the other hand, did develop MAiD training courses early on, and then their for-profit offshoot Jewel followed less than a year later with a course of their own. I took the CMA course early on in 2016, and I'm going to be diplomatic today and say that I found it to be unsatisfying. I understand the Jewel course learned from and improved upon the previous course that the CMA had developed, and I know they had some very good facilitators. I didn't ever take that course, not the least which was because it was extremely expensive, although I'm told it was quite helpful and used a fair bit throughout the province of Ontario. Around the same time, the Canadian Association of MAiD Assessors and Providers, or CAMAP, was founded and already connecting early assessors and providers and the diverse MAiD community across the country. They were hearing and experiencing very loud and clear what was needed by our membership. There was a lot of self-learning happening in a lot of different pockets across the country, and a lot of sharing of experience and lessons, but still no formal training on how to do the work and how to do it well, let alone any that was easily or affordably accessible. So within that first year, CAMAP developed and began offering very practical-based half-day MAiD training workshops developed by what at the time we considered experienced practitioners for the other practitioners based on what we had already seen and experienced and learned, a bit like the old see one, do one, teach one, to be honest. The workshop was accredited. CAMAP ran a few of these every year, always at the request of a local community who was seeking for that, seeking that input. And it was updated throughout the years, and of course, changed as the law changed and as things changed. And to date, CAMAP has actually run 20 of those workshops in 5 different provinces over the past 5 years. They've been predominantly in British Columbia or Ontario, but it's we have a fair bit of experience running these workshops at this point. That said, as we all know, we do have a federal law, and healthcare is administered, of course, and delivered provincially. So there's, in fact, a number of training programs of a variety of sorts and levels of expertise that have cropped up online or in a variety of local ways within many centers across the country at this point. Many regions recognized the need for MAiD education, and many attempted to fill it, of course, and some did so better than others, and some did nothing at all. And I feel quite certain that some clinicians still self-teach. The result being that there's basically a lack or a very little standardization of training or approach to MAiD across the country still. And a patient who has end-stage chronic obstructive lung disease in St. John, New Brunswick, for example, really ought to have the same approach and standard of care regarding a MAiD assessment as the same patient in Regina, Saskatchewan, or in Vancouver, BC. And that is one of CAMAP's hopes, of course. Resources may be different. The administration of the program may be different. Standard of medical care and especially the outcome of an assessment ought to be similar, I would say. And I understand that the offering of resources that can be provided in, say, the GTA would be different than in Northern Ontario, but still I think the approach to the assessment ought to be very similar across the country. This is all by way of background. So CAMAP applied, I seem to be missing a slide. So basically, with that in mind, in December of 2020, CAMAP was approached by a group of Canadian senators asking us to join a meeting that they were holding with a large number of national stakeholders in MAiD. We gladly accepted the invitation to attend that meeting, of course, and there was a clear desire expressed to improve the education for and standardization of MAiD practice across the country. There was a need for a recognized, robust, accredited training program, a desire to offer the public some confidence in the skills of the clinicians who are doing the work. And it was quickly determined and agreed upon by that group that with our track record and with our experience and our membership, that CAMAP should lead this effort. And the question was, would we be willing to take that on? And of course, we agreed to do this and gratefully accepted the support and advice of many of the potential partnerships that were at that table at that time. Dr. Konya Troughton and myself led the initial effort on this, and we began envisioning what that effort would entail, what it would need to look like. And over several months, with the support of those partners, we crafted a project and an application to government to fund a program which essentially, like many applications, kind of languished in due process. During that time, CAMAP actually received a targeted solicitation from Health Canada for essentially the same project, and our vision grew quite a bit. Dr. Troughton had to leave the project, so I recruited 2 new co-leads to this developing initiative. Dr. Gordon Gubitz of Nova Scotia and Dr. Madeline Lee of UHN in Toronto. And with their help, the vision grew and expanded, and a significant evaluation framework and research component was added. And last year, at almost exactly this time, CAMAP applied for and ultimately received a multi-year Health Canada grant to develop and produce the Canadian MAiD curriculum project, which is what we want to tell you about today. So that was all by way just of a little bit of context and background. The vision of this project is to produce a high quality, nationally recognized MAiD training curriculum for assessors and providers in Canada. And the aim of the program is to be informed by, sensitive to, and responsive to the needs of Indigenous, racialized, disabled, and marginalized Canadians. A big vision. Through the development and implementation of a national MAiD curriculum, we do hope to achieve these 5 objectives. To increase access to high quality MAiD training for interested practitioners, to educate new MAiD practitioners, to advance the skills of the existing MAiD practitioners, to encourage mentoring everywhere and partially through train the trainer activities, and to develop standardized approach to MAiD assessments and provisions across Canada, of course, which I keep mentioning. In terms of an organizational structure, the project's quite large and it requires a very clear structure and a well understood kind of layers of oversight. The yellow box in the middle is where I want to draw your attention. This yellow box represents what we call the Canadian MAiD Curriculum Development Committee, or what I will refer to as CMCDC. This is the executive committee for the project, responsible for oversight of all the content, and this committee retains the decision-making authority for the project. It's chaired by Dr. Gordon Gubitz. It's made up of a geographically diverse group of, I think we're 10 subject matter experts with significant experience in the clinical practice of MAiD in Canada. There is representation from both physician and nurse practitioners, male and female, primary care specialist, anglophone and francophone. The CMCDC is responsible for recruiting and appointing leadership to each of 8 working groups, or actually in reverse. Essentially, the leader of each working group sits on the CMCDC. The working groups represent the subject matter experts responsible for actually developing the content for each of 8 educational modules that together will make up the entire curriculum. And again, every effort has been made to strike working groups that are diverse with respect to geographical experience, clinical background, to consider potential inclusion of those with lived experience where it's appropriate. And most are between about 4 and 8 people, I would say, for the majority of them. For a quick overview, that didn't come out very well. Anyways, for a quick overview of the module content itself, you can see here the list, the titles of the 7 modules that are being developed. And just to clarify, the 8th module is on clinician resilience and reflection. It's content that's been carefully crafted to weave throughout the other 7 modules. So it's not a standalone module on its own, but woven within and throughout the entire curriculum. So we're 8 working groups. You can see the names of the leads for each of the working groups. So for example, I'm leading working group 1 on the development of the foundational module, the foundations of MAiD in Canada, essentially how we got here, where we are now. You know, much of that is an overview of the eligibility criteria and the safeguards that are in place, an introduction to ethics and the resilience concepts, basically seeding what will be developed in further and later modules. So the project is developing several modules with the content of the 8th woven in with the others that together will make up the entire curriculum. As for oversight, the CMCDC, of course, will oversee and vet the content as it's being developed and give input to that. But the final work of the project is, of course, ultimately overseen by the CAMAP board, which will need to approve its final iteration. Not so much an authority as an advisory group and support group. We also have a national steering committee made up of a number of those significant national stakeholder organizations that I had briefly mentioned before, plus a few others. And they partner with us to provide resources where possible, to review material for relevance to their membership organizations, to make sure we haven't forgotten that particular lens, and ultimately to help accredit and disseminate the product nationally once it's ready. For a quick view here, you can see a current list of the organizations that sit on that committee, who will also have a chance, like I mentioned, to review and comment on our material during its development. We're very, very pleased with the representation on this committee. Certainly includes the College of Family Physicians of Canada, the Royal College of Physicians and Surgeons of Canada, the CMQ from Quebec, the Canadian Nurses Association, Nurse Practitioners Association of Canada, and you can see many, many, many others. So quite a diverse group, and we're very, very, very pleased to have their support and partnership. And of course, we do report to Health Canada, who has generously funded us for the 3.5 years of the life of the project. So we do report back to them for scheduled deliverables and updates, but for no other purpose than that. We have hired a project team. We have a project manager, a project coordinator, and an admin support person. And importantly, we have contracted with the Office of Professional Development and Educational Scholarship at Queen's University to produce the product itself in both English and in French, and for both online, asynchronous, and in-person synchronous subject matter-led training modules, which will be workshops that are given. So that's the kind of the overview of the project structure. The project is being co-led, like I mentioned, by Gord Gubitz, who chairs the Yellow Box CMCDC Executive Committee, myself, and the president of CAMAP, resident visionary and liaison to the CAMAP board, and Dr. Madeline Lee, who's our scientific lead, who has structured and implements our evaluation and research framework. And I will now very gratefully hand the mic over to Madeline to explain that part of our project. And I'm happy to move the slides for you, Madeline.
Great. So next slide. What I have, I've got like 3 or 4 slides just to go over some of the research components that will accompany this project. And I'll just start by saying that this is an implementation science project. So our evaluation framework is built on that. And for those not familiar with the terms, I'll go over them in a bit more detail on the next slide, but that there's a formative and process evaluation that really just looks at the metrics around implementing and developing the curriculum. But then, we have deliverables to Health Canada, which are to look at what are the impacts of launching this curriculum in the healthcare system. And I had proposed looking at 3 levels of impact on clinician outcomes, right? Do clinicians feel more confident? Does it affect the number of practitioners out there? Quality outcomes. So is there more consistency around how people are applying the legislation? Is there more attention, important to this group? Is there more attention to how we assess suffering or psychosocial vulnerability? And then more health systems impacts. And again, this was based on deliverables to Health Canada around wanting to integrate, will this curriculum help? Actually, it was one of our asks that the curriculum would help integrate the relationship between MAiD and palliative care, for example, and I'll talk maybe a little bit about that. So actually, the orange part talks more granularly about how we're going to evaluate each of these components, but it's actually more clearly described on the next slide. So before you move, I'll just say we have a hard launch. Stefanie didn't give you timelines, but we have a hard launch planned for September 2023. And when I talk about these evaluations, pre-launch is 6 months before that hard launch, and post-launch is 1 year after that hard launch. So it's a 3.5-year project. Those are the timeframes for the kind of evaluation we're going to do. So next slide. So as I said, formative evaluations, these are the goals for how we're going to evaluate, are really meant to develop and improve course content. And we started with a needs assessment survey of practitioners, not just current assessors and providers and people involved in MAiD, but generally clinicians in Canada. And I'll show you one slide from a preliminary slide from that at the end. That needs assessment will also include key stakeholder interviews in a more qualitative way, because I really want to understand what are the needs. I'm already getting a sense that we don't have enough information about sort of the needs in marginalized groups like the Indigenous populations, and we'll probably have to go in and do actual qualitative needs assessments in there. And then, of course, the content will go through utility testing with a pilot group, and we'll do a soft launch with focus groups where we'll measure their satisfaction. We will capture process evaluation, which is what is the implementation of this? So what's the reach? Are we covering all provinces in terms of coverage and disciplines and the numbers? And those are metrics we'll capture from the curriculum every 3 months. I think the most relevant things are what are the outcomes that will go with this curriculum and looking at impact. And so to measure impact on clinicians, I just want to outline here, there are many kinds of data elements that we'll use, but one is we'll certainly do pre and post completing the curriculum, the Canadian MAiD curriculum, that's CMC, immediately pre and post completing their curriculum. We'll look at knowledge, we'll do that evaluation about what's the effectiveness of the curriculum. But then we'll also do a MAiD clinician practice survey, pre and post hard launch. And then the post hard launch, we can stratify that by those who did and did not complete the curriculum. Lots of questions we can ask around that. And the MAiD practice pre-launch survey is actually something we're doing in collaboration with Melissa. We're looking at what is the status of clinician practice now. And these are targeted at people currently working with MAiD. Melissa has developed a survey that we've paired to minimize the burden on clinicians in terms of multiple surveys. I think Melissa's interest around that is really, again, more around how are people assessing suffering, but we've managed to merge the two efforts. And then output in terms of the impacts on the healthcare system. We will be able to compare pre and post hard launch metrics from the federal reporting database, right? So how many providers are there? Is there an increase in number after this curriculum, for example, just from that database? But also we'll be doing, so whereas C is measuring MAiD clinicians, D is measuring healthcare providers, whether they're MAiD clinicians or not, in the system, pre and post hard launch, stratified by those who may have taken the course. And I'll give you on the next slide some examples of how we would do that analysis. So next slide. Okay, so these are, I think in the end will be a very rich database. We can ask all kinds of questions. So I'm looking forward to hearing what people will say in the groups this afternoon, if you have any suggestions for other questions we might ask. But these are 3 questions that were pre-formed and put into the Health Canada proposal because they directly addressed what Health Canada asked for us, right? So will we be able to help integrate MAiD into end-of-life planning and practice? And so the kind of question we can ask is, will taking the clinical conversations module, and the other thing I should emphasize is that not everyone will have to take all the modules, right? There will be, so even if you don't plan on participating in MAiD, at providing or assessing a case, you could still take that clinical conversations module, or you could take the foundations module, or it's something that students might want in the future in terms of undergraduate curricula. So the course content will be modular in that sense. So the question is, would taking the clinical conversations module, which is about initial conversations with MAiD, a patient asks you for MAiD, how do you have a conversation about whether to go ahead with it, how, what should they be thinking about, what's the process? Does taking that module alter attitudes in general on perceived competence about goals of care conversations, and including MAiD in palliative stage patients? And so that's the kind of question we can ask from doing this general healthcare provider survey post-launch. Another kind of question is, does completing the provider module in MAiD, right? How do you provide MAiD? Does that increase comfort and use of final consent waivers? Again, that was a request from Health Canada, but I also think it will inform us in the future about advanced directives, which we were talking about in the last session. And we can analyze that by looking in a stratified way post-launch at the clinician practice survey post-launch, stratified by those who took the course and didn't take this course. And I think an interesting question that also we'll pull out of the federal database is, I wonder if taking the course changes the amount of time between assessment and provision, in the sense of this is how we use consent waivers. That's a very granular thing that we can talk about more in terms of how people are using consent waivers, but there should be guidance in this module on how to use those consent waivers. And will it make a difference whether you've taken our course or not, how you use them? And we'll be able to get that data from the federal reporting database. And then the last question that I wanted to ask that again, I think is relevant to this group is, does completing the capacity and vulnerability module increase knowledge and attention to psychosocial vulnerability or assessment of suffering? And again, we can do this 1 year post-launch clinician practice survey, stratified by those who didn't take this module. And my thought was that we would use scenario-based cases in that evaluation. And I think ultimately, well, now that, I think at the time we came up with this, we didn't know what was happening with MAiD and medical illness, mental disorders as a sole underlying medical condition. But actually, it's very clear now that this kind of survey can inform the safety of how we're doing that. So I'm going to stop there in terms of describing the evaluation pieces. I think there's a needs assessment piece at the end, but I'll let Stefanie.
Yeah, so it's actually just coming up in a minute. I think I'm just going to highlight a few of the key milestones just so people have a sense of where we're at with the project. So just a few of the highlights. We were funded since October of 2021. We did have a large kickoff meeting in December of 2021. The work actually started, in the summer, but these are the official milestone dates. And we did do a needs assessment that was completed, and the final reporting was completed in June of 2022. And if you wanted to comment on that, I'll just do it right here.
Yeah, so we've got lots of needs assessment data back. We managed to get responses from 257 clinicians, and of course, 60% of them were already involved in MAiD, 40% weren't. So this is a slide that combines the answers from both. I think it'll be interesting to stratify them, which we'll do. So this is a very preliminary look, and what I've reported here for you is I pulled out of that needs assessment just what the needs are in terms of different domains that we asked them. And this is the percentage of respondents who thought that this was important or very important in terms of developing guidance and education for them in our curriculum. And I think what's interesting is that actually overall, almost 60% really feel that these are important issues. But I think you can look at the difference in some of the specific questions. So I included here, we did ask about, like the second one down, how to assess intolerable physical or psychological suffering. And half the population thought that that was very important. Interestingly, if you look at the bottom one, how to consider diversity, cultural competence, and vulnerabilities, fewer thought that that was very important. And I don't know if that stratifies differently by experienced providers and the non-experienced providers, we'll see. But I thought I would just give you a snapshot of what we asked and what people think are important. And I also think this list, if you can see it, I think helps you see what we think are important issues that we need to train people by, just so that you can see what we already had in mind. We have there how to assess depression in the context of MAiD eligibility. The majority thought that was important. And I suspect though the 40% that didn't are the experienced providers. Again, I think stratifying this will be important. But that's all I really wanted to say about this slide.
Yeah, great. I just wanted to add this in as well. Just the formatting seems a little bit off with my conversion from PowerPoint to Keynote. But the point is just to add that the project's also outlined a kind of a well-described process for both internal and external review of the material before it's being produced. with the opportunity for a number of different types of reviewers to provide substantive input. So just to keep in mind that that is, I'm not going to go through this right now, but there's lots of process that's been outlined. And with that in mind, just to let you know that Module 1 has already been storyboarded, that's been complete and is now under external review, and along that process is kind of chugging through the system as our first module to do so. Contents for modules 2, 3, 5, and 6 are already completed and ready for internal review, so just one step behind Module 1. All this to say that the material is coming through this summer, and we'll be going through that process, and we seem to be on time for most of our timelines, she says carefully. The pre and post module evaluations have been drafted, that will be reviewed and tweaked. Our pre-launch survey has been finalized. That's the partnership with Melissa's group, and is ready to go out, or has already gone out, I think, to some already. So that's all happening. Our immediate next steps are to start preparing for the soft launch for the pilot testing, which will be beginning this fall. Very exciting to see that happening. We're going to be developing the implementation toolkit for knowledge translation, which will happen a little bit later on, but it's time to start working on that. And we're already planning and recruiting for our train the trainer workshops for the facilitators, for those who will be doing these synchronous sessions with colleagues across the country. So that's kind of where our focus will be this fall. And in summary and in very common language, I'm trying to tell you that our content's being developed by a diverse group of experienced subject matter experts. The product will be reviewed through a diverse set of lenses. It will be produced by an educational design experts at Queen's. Will definitely require annual review. We're aware of that, to incorporate clinician experience and learning and changing law, an evolution of MAiD in Canada. It's essentially going to be considered an evergreen project that we hope will be widely available and utilized at low cost. It will certainly be run strictly on a cost recovery basis after our funding runs out. And these are just some of the people that are involved in our working groups and are doing the heavy lifting right now. So just wanted to give you a sense of who they are. And we're happy to take any questions.